Hi, I'm Beth Ann, and I'm from the Capital Area Intermediate Unit Rapid Response Team, and I'm here to talk to you about navigating behavioral health resources for your preschool-aged child. You may be concerned about your preschool-aged child's behaviors. You're not really sure where to go to get help for these behaviors. We're here to help guide you. Have you ever had a child care center or your sitter who's concerned talking to you about your child's behaviors? And you're just feeling worried for your child, or you just yourself, you're just not sure what to do, and it's just getting a little bit more challenging. Well, you're not alone, and we are here to help you look at some options for that. Listed on this slide are a few of the ones that we will talk about today: pediatricians, early intervention, early learning resource center, rapid response teams, 211, outpatient options, and many more. One of the first things we do when families come to us with a concern about a child's behavior is to ask them to contact their child's family practice physician to rule out any physical concerns that may be a factor to your child's behaviors. You can also contact your insurance company to find a pediatrician in your area if you would like to have the opinion of a physician specializing in children's development and medical care. If you have concerns that your child has a delay in an area of development, you may want to discuss this with your pediatrician, or you can contact your local intermediate unit or early intervention agency. I have provided here a link for you to be able to find your agencies near you. There's also a connect line for you to call to be able to find those resources as well, and that is 1-800-692-7288. I also provided at the bottom an intermediate unit link to be able to find your local IU. Again, the Connect helpline is 1-800-692-7288. Again, here's the link to be able to find your county early intervention in your area. You may at times have heard from your child care center regarding some difficulties that they're having with your child's behaviors. You can help them by reminding them about a resource that is available to them, and that is the Early Learning Resource Center, or the ELRC. You can contact your area STAR manager, and they can come to the center to help to try to figure out what strategies and tools might be best for your child or children within that center. The STAR quality coach can support and respond within a quick manner to be able to help. The links to these resources are pakeys.org, and there's also raiseyourstar.org, and child care consultants. They exist in certain areas throughout the Pennsylvania area, and they're connected to the Early Learning Resource Center as well. There are links to be able to show you how to get to those, but again, your center can also reach out to them. The Office of Child Development and Early Learning, or OCDEL, is an excellent resource for you and your family, and they provide resources to child care centers as well as to you. And here is a link. The Pennsylvania Key, or PA Keys, is a partner with the Office of Child Development and Learning, and they offer a multitude of services for children and their family to help assist with their early education. I put some links here for you as well, and some of them are for knowing a little bit more about PA Keys, but also information on promoting inclusion and expulsion and suspension. So if your child is facing a suspension or has had a few suspensions or being told possibly that they will be expelled from the center, this is a great resource for you to be able to check. If your child is experiencing the threat of a child care expulsion or suspension, Rapid response teams may exist in your area. They are county specific. The Rapid Response Team with the CAIU is a team that is deployed to a child care center to help the center when providing additional strategies and tools when a child or children are experiencing difficult behaviors and at risk for being expelled or suspended. The children are not currently connected to an early intervention program. The Rapid Response Team is an additional support to some of the counties in the Child Care Consultants Early Learning Resource Center Region 9 area. The team can be accessed through the Child Care Consultants referral system, and the goal of the Rapid Response Team is to help children retain in their care setting and to prevent expulsion and suspension due to challenging behaviors. 211. 211 is, I kind of call it the magic number across our state, and it is numbers that you can call for resources, for a variety of different types of needs for you and your family. And also, they can help you find local support groups or other type of family caregiver resources. Parent-child interaction therapy, or PCIT, is an evidence-based treatment for young children with behavior problems. I often tell families about this when I am called about these concerns so that the families can learn different ways to manage a child's behavior through coaching by a therapist. PCIT.org is an excellent place to go to try to find a local PCIT provider, but you can also check with your insurance company and they can help you locate some in your area. There are county mental health, autism, intellectual disability, and developmental delays service agencies in your area, and I put the link here for you to be able to find yours in your area. They have so much information about behavioral health, mental health, all sorts of different type of agencies and resources and supports. Please keep them in mind when you're trying to find some supports. Insurance is something that I ask every single family when they are calling me about resources for behavioral health or mental health. There are a variety of services that are accessed through different types of insurance. If you have private insurance, some individuals may have it, and this example is like some may have like Blue Cross or Blue Shield. I suggest that you contact your behavioral health number, and this is listed on the back of your child's insurance card, and this can help you determine other resources that may be available to you and your family. There's someone there to be able to help you figure out in your area which possibly could be the best resources to start with. You may find that some services or resources through agencies require that your child has medical assistance. You can apply for medical assistance through the COMPAS site, and that is at www.compass.state.pa.us. And if you need some assistance in how to apply, we have a virtual step-by-step guide on how to apply for medical assistance. Please check out that video. If your child has medical assistance and you're trying to figure out what agencies or supports are best out there for your child, you can contact your county behavioral health overseer. And they are different ones throughout our state. We have Magellan, Perform Care, Community Care Behavioral Health Organization, Community Care Behavioral Health, Value Behavioral Health. And to be able to check to see which one is in your area, please go to this site located on this slide. CASP, Child and Adolescent Service System Program, or System of Care Coordinators, are located in each county, and they can help direct you with the services your child, youth, or young adult may be eligible for in your county. I provided the link to be able to find who is your coordinator in your area. Please keep in mind they may not be called CASP coordinators, they may be children's specialists or other type of terms of names. If your child's been diagnosed with autism and you're not really sure where to go next, there are some different resources that can be provided for your child. There's the Applied Behavioral Analysis, or also known as ABA, which is a behaviorally based program that can greatly benefit your child that's been diagnosed with autism. There are a list of ABA providers located in the www.abanpa.com under the resource tabs. Also, please check out our autism video, Autism Assessment, Diagnosis, and Resources for additional information. You may be finding that your child's behaviors are becoming more severe, or you even have had a request from your child's child care center for additional supports for behaviors. Often what is said is behavioral health rehabilitation services or therapeutic staff support, also known as TSS. There are some steps to take for you to determine if your child is eligible for those services, and I'm going to go over them as quick as I can, and hopefully this will help kind of guide you to the direction to be able to at least try to figure out what to do. Your child will require an evaluation to determine if the behavioral health services are recommended. You're going to need to locate an agency to help you with this evaluation. And currently these can be done with a psychologist or psychiatrist. My recommendation is that you contact your insurance company. If you have private insurance, please refer to that number I talked about earlier that's on the back of your child's insurance coverage where it lists the behavioral health resources. Contact them and ask them for agencies that could help you find an agency that does these evaluations. If your child has medical assistance, please contact your county area managed care organization. I mentioned those earlier. They can be found in your area through this link that's listed here. These type of services will require medical assistance. Even if you have private insurance, eventually you're going to need medical assistance to help with the payment of these. So it's going to benefit you if you start this early, this process. So again, the medical assistance application link is compass.state.pa.us, but I gave you a direct link for that. Please note that there's going to be changes to the BHRS system in January 2021. These services are going to fall under intensive behavioral health services, and there's going to be different service names and roles, and there's going to be different criteria to meet these services. I put a link here for you to be able to see that. And here's some additional information about those services. And again, just kind of telling you steps on how to get an evaluation to determine if they're even something that's going to be approved or recommended for your child. Outpatient resources. Now, I've just provided you with a few of the ones that are often said, but I want you to keep in mind the ones that sometimes are not mentioned. Play therapy. There are options in your area that you, again, can look through your insurance company to find to see if there's a local play therapist or type of therapy that can be best for your child. Sometimes play is just the best type of therapy for young children. PCIT, I mentioned that before, the parent-child interaction therapy. And then some people don't think about this, but there are supports for parents and caregivers that are in your local area at times, and training for how to deal with different behaviors or challenging behaviors. So please reach out to your insurance company for some of those ideas, but also don't forget that 211 number. They can help you with trying to find some in your area as well. Crisis intervention. There may be the need for more intensive response to behaviors, and I wanted you to have the different helplines. There is the PA Support and Referral Helpline. There is the National Suicide Prevention Lifeline. There is the line in Spanish. There is the crisis text line, text PA to 741 741, and I have listed different county links to be able to find your county crisis intervention. The following are a list of Pennsylvania Department of Education resources. Again, 211 is listed, Kin Connector, the DHS Assistance has a lot of different resources that you can locate. In addition, there are helplines such as a DHS Warm Line. And this is a line that was created during this COVID-19 time period. So it is there currently. I'm not sure how long that's going to be on there. There's the mental health and suicide crisis lines and the links. And again, the crisis text line that I mentioned earlier. There are resources for autism and intellectual disabilities listed, such as AID and PA, Parent to Parent a PA, and PA Family Network. These resources are great for families to reach out to have a personal, even sometimes peer-related response of family members who have experienced or are experiencing similar difficulties or challenges, and just someone for you to reach out to be able to kind of connect with and get resources and understanding. There is also early childhood resources such as early intervention. Again, listed are the numbers for the Connect line, and the ELRC or the Early Learning Resource Center link is there. There are case management and coordination of care services links. So again, the mental health developmental service agencies, there's the special needs unit, and the Special Kids Network helpline. Thank you so much for joining me today. I hope that you and your family are able to take away some resources that can help you and your child with their behaviors, and just for you to have a bunch of different places to go for supports and resources. Again, thank you so much. We really appreciate you, and just know that you are not alone.